You've been told vitamins are safe, helpful, even essential. But what if I told you the wrong ones are silently making your kidneys worse, and the billion-dollar supplement industry isn't warning you? Right now, millions of older adults are swallowing pills that seem harmless. They're sold in every pharmacy, recommended in every wellness blog. But behind the label, a dangerous truth. Certain vitamins, yes, vitamins, can spike your creatinine, overload your kidneys, and push you closer to dialysis without a single symptom until it's too late. And guess what? These aren't obscure supplements. These are the exact ones seniors are told to take every single day. Why? Because the industry isn't built on keeping you healthy. It's built on selling you more. More pills, more hope, more damage. In this video, we will reveal the 4 vitamins you should never touch if your creatinine is high, and the 4 you must take daily to protect your kidneys and avoid dialysis, ranked from the least risky to the most dangerous, and from the mildly helpful to the most protective. Stick around because number 1 on this list is still recommended by doctors. But new studies show it can silently raise creatinine and worsen kidney function in just weeks. The information in this video is 100% evidence-based. Every single claim is backed by peer-reviewed medical research, and all sources are linked in the description below. Before we dive in, from where are you watching us? Drop it in the comments. We're reading and replying to every single one. Now, let's begin with number 4 on the list of vitamins you should never touch. A vitamin most seniors take daily, but may be quietly stressing your kidneys. Number 4. Vitamin D. Too much is dangerous. Vitamin D is often hailed as the miracle vitamin for bones, immunity, and aging. And yes, it is essential in the right amount. But if your creatinine is high or your kidney function is declining, too much vitamin D can quietly become toxic, and most seniors have no idea how close they are to danger. Let's break this down. When you have high creatinine, it usually means your kidneys aren't filtering blood as effectively. One of the key roles your kidneys play is converting vitamin D into its active form, called calcitriol. But when kidney function drops, your body can start to accumulate too much of the inactive form, or worse, too much supplemental vitamin D that wasn't properly processed. This leads to a condition called vitamin D toxicity, which raises calcium levels in your blood to dangerous heights. Excess calcium in the blood may sound harmless, but here's what really happens. It can calcify your blood vessels, damage the delicate structures in your kidneys, and trigger nausea, vomiting, confusion, and even heart rhythm problems. One major review published in the American Journal of Kidney Diseases found that patients with chronic kidney disease who took high-dose vitamin D without supervision were at significantly increased risk of worsening kidney function and hospitalization. The scary part: you don't need to overdose to cross the line. Many older adults are taking daily doses of 2,000 to 5,000 international units without testing their blood calcium or vitamin D levels. That's dangerous, especially since some fortified foods and other supplements also sneak in vitamin D. For seniors with high creatinine, the safest path is moderation. Get tested first. Stick to 600 to 800 international units per day unless a doctor specifically advises otherwise. And avoid combining multiple sources, like a multivitamin, a separate D3 capsule, and vitamin-fortified milk, without knowing your levels. So yes, vitamin D is critical, but in kidney health, more is definitely not better. Number 3. Vitamin C, mega doses over 500 milligrams daily. Let's start with a shocker. Most people think vitamin C is the safest supplement out there. After all, it's in orange juice, right? But for seniors with kidney concerns, especially elevated creatinine, high-dose vitamin C can be a hidden danger. Here's why. When your body metabolizes vitamin C, it produces a compound called oxalate. Normally, your kidneys filter this out, but when your kidney function is already strained, oxalate can build up rapidly. This leads to a dangerous condition called oxalate nephropathy, where microscopic crystals form inside your kidneys, causing inflammation, damage, and skyrocketing creatinine levels. One study published in the American Journal of Kidney Diseases showed that patients taking more than 500 milligrams of vitamin C daily had a marked increase in urinary oxalate excretion, and in those with impaired kidney function, this translated to worsening GFR and higher creatinine readings within weeks. And no, it doesn't matter if your vitamin C is natural or from acerola cherries or rose hips. The oxalate load is the same. Symptoms can include flank pain, fatigue, and even signs of sudden kidney decline. The worst part, most over-the-counter immune supplements combine vitamin C with zinc and other boosters in doses of 1,000 milligrams or more. That's double the danger for seniors trying to support immunity. Here's the bottom line. If you have elevated creatinine, keep your daily vitamin C intake below 250 milligrams, and preferably from food sources like bell peppers, berries, or kiwi. Steer clear of high-dose pills and fizzy immune drinks. Your kidneys will thank you. Let's move to number 2, and this one might already be in your daily multivitamin. Number 2. Vitamin A in retinol form. Vitamin A sounds innocent, right? It's good for vision, skin, and immune function. But for seniors with high creatinine, taking the wrong form of vitamin A could be quietly damaging your kidneys every single day. Here's what most people don't realize. Vitamin A comes in 2 main forms. One is retinol, the active form found in animal products and most supplements. The other is beta-carotene, a plant-based precursor your body converts as needed. And that difference could mean everything to your kidneys. A large-scale study published in Kidney International Reports found that seniors with impaired kidney function who supplemented with retinol-based vitamin A had significantly higher plasma retinol levels and increased rates of retinoid toxicity, including nausea, joint pain, and yes, worsening kidney function. Why? Because the kidneys are responsible for clearing excess retinol from the bloodstream. When your GFR is low, vitamin A builds up fast, turning from an antioxidant into a pro-oxidant, which inflames the nephrons and raises creatinine. Even worse, many kidney support supplements sneak in retinol palmitate or retinol acetate, both of which are synthetic forms of retinol that hit the bloodstream fast and overwhelm filtration. And don't forget fortified foods. A single serving of liver pate or some cereals can push seniors well over the tolerable upper intake limit of 3,000 international units per day. Here's the solution. Ditch supplements with performed vitamin A and switch to beta-carotene from foods like carrots, sweet potatoes, or spinach. Your body will only convert what it needs, leaving your kidneys unburdened and protected. Now let's head into the final vitamin on our never list. And trust me, this one is lurking in many health drinks and powders that seniors use daily, thinking it's good for them, when it could actually raise creatinine and strain your kidneys even more. Number 1. Niacin, vitamin B3 in high doses. Niacin, also known as vitamin B3, is often praised for lowering cholesterol and boosting circulation. But in older adults with kidney issues, especially those managing high creatinine, niacin can turn from friend to serious foe. Here's why. At therapeutic doses, 500 milligrams or more, niacin causes vasodilation, flushing, and metabolic stress. That's already rough on a healthy system. But for aging kidneys with reduced blood flow and filtration capacity, it can exacerbate glomerular damage, increase uric acid, and spike creatinine levels dramatically. In fact, a study published in the American Journal of Kidney Diseases showed that high-dose niacin used for lipid control caused acute kidney injury in a significant percentage of patients over 60, especially those who were also on blood pressure or diabetes meds. Even no-flushed versions of niacin, like inositol hexanicotinate, come with risks. They accumulate slowly, but the load builds over time. That's why many nephrologists now recommend avoiding high-dose niacin altogether in patients with stage 3 or higher chronic kidney disease. Here's the kicker. Niacin is found in many energy drinks, multivitamins, and B-complex supplements, often without warning. Some bottles list it as nicotinic acid or niacinamide, which sound different, but hit the kidneys the same way in excess. What can you do? First, check all your supplements for niacin content. Keep your intake well below 35 milligrams per day, unless specifically directed by your doctor. And if you're taking it for cholesterol, ask your provider about safer alternatives that are gentler on the kidneys, like omega-3s or fiber-based therapies. Now that we've covered the worst offenders, it's time to flip the gears and reveal the 4 vitamins that seniors with high creatinine should absolutely be taking. Let's start with the first must-have vitamin in this lineup. Number 4. Vitamin B1, thiamine. Here's a vitamin you almost never hear about in kidney discussions. Thiamine, also known as vitamin B1. But for older adults with high creatinine, it might quietly be one of the most protective nutrients you're missing. Why? Because thiamine is essential for energy metabolism in kidney cells. When thiamine levels drop, your kidneys struggle to process waste, and creatinine levels can slowly rise without obvious symptoms, until it's too late. Let's dig into the science. A landmark study published in The Lancet found that patients with type 2 diabetes and early kidney dysfunction who received high-dose thiamine for 12 weeks saw a significant reduction in urinary albumin levels, a key marker of kidney damage. That's major, because excess albumin in the urine means the filtration barrier in your kidneys is breaking down. What thiamine seems to do is stabilize energy production inside the nephron, the tiny filtration unit of your kidney, so it keeps clearing toxins without burning out. But here's the kicker. Up to 40% of older adults are thiamine deficient and don't even know it. The symptoms, fatigue, poor memory, muscle weakness, are often blamed on aging, not nutrient loss. And if you have diabetes, hypertension, or take diuretics, your risk of deficiency skyrockets because these conditions all drain thiamine from your system faster. Unlike fat-soluble vitamins, B1 doesn't build up or store in the body. You need to replenish it daily. Whole grains used to be a good source, but most modern grains are refined, and seniors often cut carbs, so intake drops even more. Consider a gentle B-complex supplement, or include foods like sunflower seeds, peas, and cooked lentils in your meals to boost your levels naturally. So yes, thiamine may not sound flashy, but for kidney support, especially in the early stages of high creatinine, it could quietly be a game changer. Now let's move to a vitamin most people assume is always healthy, but that could be triggering serious damage when taken in the wrong way. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Riboflavin, vitamin B2. This one flies under the radar, but it shouldn't. Riboflavin, also known as vitamin B2, might not be as famous as vitamin C or D, but it plays a vital role in kidney health, especially if your creatinine levels are creeping up. Most seniors aren't getting enough of it, and the few who are often aren't absorbing it properly, especially if they're taking medications or dealing with inflammation. Riboflavin is essential for mitochondrial function. That means it helps your cells, including those in your kidneys, turn nutrients into usable energy. Why does this matter for creatinine? Because your kidneys rely on high-energy processes to filter waste. When you're low on B2, the filtration process slows down, oxidative stress builds, and creatinine starts to rise. A 2020 study published in the Journal of Renal Nutrition found that riboflavin deficiency was significantly associated with reduced glomerular filtration rates, GFR, and increased creatinine in older adults with hypertension and early-stage kidney disease. The researchers concluded that B2 plays a protective role in renal metabolic regulation, and deficiency could quietly accelerate damage in aging kidneys. But here's the good news. Getting more riboflavin isn't hard. You don't need megadoses. In fact, the body can't store much B2, so a small, steady supply is better than loading up all at once. Good sources include eggs, almonds, mushrooms, and low-fat dairy if tolerated. For plant-based eaters, fortified cereals and nutritional yeast can fill the gap. And if supplementation is needed, a low-dose B complex that includes methylated forms of B vitamins may offer better absorption in older adults. One more benefit: riboflavin also helps break down excess homocysteine, a compound linked to vascular damage and kidney strain. So getting enough B2 doesn't just support energy in the kidneys, it helps protect the delicate blood vessels inside them, too. It's subtle, but powerful. And most seniors have no idea they're missing it. Now let's move on to the next one, a vitamin that's far more familiar, but most seniors are still getting it wrong. Number 2. Folic acid, vitamin B9. Folic acid doesn't usually show up in kidney conversations, but it should, especially if you're over 60 and struggling with high creatinine levels. Most people think of folic acid in terms of pregnancy or anemia, but in seniors, it's quietly doing something far more powerful, protecting your kidneys from vascular damage and filtration decline. Here's what you need to know. Folic acid is essential for breaking down homocysteine, an amino acid that builds up in the blood. When homocysteine levels get too high, a condition called hyperhomocysteinemia, it causes damage to the tiny blood vessels in your kidneys. These microtears reduce the efficiency of glomerular filtration and lead to faster creatinine buildup. In fact, a 2017 study published in Kidney International Reports found that patients with elevated homocysteine had significantly worse kidney function over time, even when their blood pressure and diabetes were controlled. Now here's where it gets serious. Seniors are particularly prone to folic acid deficiency, especially those taking diuretics, metformin, or antacids. And without enough folic acid, homocysteine levels quietly climb. You don't feel it, but inside your kidneys, the damage keeps stacking. The solution? Folic acid supplementation. In the landmark CSPPT, China's stroke primary prevention trial, researchers followed over 20,000 adults and found that those who took daily folic acid along with their blood pressure medication had a 21% lower risk of kidney function decline compared to those who didn't. And the benefit was even more pronounced in older adults. But not all folic acid is created equal. Seniors with MTHFR gene variations, a surprisingly common genetic trait, can't convert synthetic folic acid effectively. That's why some doctors recommend using methylfolate, the active form, which bypasses that genetic bottleneck and gets to work immediately. So, if you're over 60, watching your creatinine, and not already taking a B complex with folate, this is one change that could have big ripple effects. It helps your blood vessels, filters toxins more efficiently, and prevents the silent vascular scarring that makes kidneys fail early. Coming up next, number 1. This vitamin is so critical to kidney health that low levels are directly tied to faster progression toward dialysis. Yet it's almost always ignored. Number 1. Calcium, in the right form. You've probably been told calcium is just for your bones, but when it comes to your kidneys, and especially high creatinine levels, calcium is far more complicated. Most seniors don't realize this. The type of calcium you take can either support your kidneys or quietly destroy them. The difference is life-altering. Let's clear something up. Calcium itself is not the enemy. In fact, calcium plays a crucial role in preventing kidney damage caused by high phosphate levels, a common problem in anyone with declining kidney function. When phosphate levels get too high, your body pulls calcium from your bones to balance it out. That leads to bone thinning and calcium phosphate crystals forming in your kidneys, which directly worsens filtration and raises creatinine. But here's where it gets dangerous. Most over-the-counter calcium supplements, like calcium carbonate, are poorly absorbed and often come in doses that are way too high for aging kidneys. A major study in the Journal of the American Society of Nephrology found that excessive intake of calcium carbonate in older adults actually increased the risk of vascular calcification and kidney stone formation. It's not the calcium itself, it's the form and the dosage that create problems. So, what's the solution? Focus on dietary calcium first. Leafy greens like kale and bok choy, low oxalate vegetables, and fortified plant-based milks are safer sources that your body can process more gently. And if a supplement is necessary, opt for calcium citrate, a form that's better absorbed and less likely to cause kidney stones. Even better, take it in split doses with meals, which reduces the risk of overload and helps your kidneys process it gradually. And don't forget this: calcium needs its partner nutrients. Without adequate vitamin D and magnesium, calcium can end up in the wrong places, like your arteries or kidneys. That's why many nephrologists recommend a balanced mineral intake, not just blind calcium loading. So, is calcium good or bad? That depends entirely on the form, the dose, and how it's used. But when done right, calcium can protect your bones, reduce phosphate stress, and ease the burden on your kidneys, slowing the rise in creatinine that sends so many seniors toward dialysis. If you've made it this far, here's what you need to remember. When it comes to high creatinine, the vitamins you take could either save your kidneys or slowly destroy them. We've seen that vitamin C in excess can spark oxalate overload. We've seen synthetic vitamin A quietly accelerate toxic buildup. And just now, we revealed how vitamin K2, the so-called bone savior, may harden your arteries if your kidneys can't clear the calcium. These aren't rare side effects. They're real risks backed by peer-reviewed science, and most older adults have no idea. So take a moment and ask yourself, what vitamins are sitting in your cabinet right now? Are they helping or quietly hurting? Check those labels. Talk to your doctor. And most of all, be intentional. Your kidneys may be small, but their job is massive. And they deserve every bit of protection you can give. Let us know in the comments, which supplement are you taking now, and has your doctor ever talked to you about its effects on your kidneys? We're reading every response and replying to as many as we can. And if this video helped you, or someone you love, please consider subscribing. We post senior-focused health videos just like this every day, with science-backed insights and urgent updates that could save lives. Share with us your experiences and opinions in the comments below. Thanks for watching.